fresh day to all of you. This is your student nurse, Louise Tadena. And for today's demonstration, I will show you how to take a health history interview. So without further ado, let's get started. Good evening, sir. I am your nurse for the day. I am Louise.
Good evening din po.
May I know your name, sir?
Juan Miguel Horinario po.
What do you prefer me to call you, sir?
Miguel na lang.
Sir Miguel, do you want some alcohol? Okay, sir. I will going to ask you some questions for your history health interview. So your full name is Juan Miguel Horinario. Okay. Please state your address and phone number, sir.
Block 23. Is it 0967?
Your date and place of birth.
January 20, 2003. Santa Mesa, Manila.
Okay. Nationality or ethnicity.
Filipino.
Marital status.
Single.
Religious or spiritual practices.
Wala.
Okay, not. Your primary and secondary languages, spoken, written, and read birth language.
Tagalog po and English.
Tagalog and English. Educational level.
High school graduate.
High school graduate. Occupation and working status.
Wala.
None. Who lives with you, sir?
Papa ko po, tita ko po, tsaka dalawa kong kapatid.
So, sir, we'll now proceed for the reasons for seeking healthcare. What is major healthcare or concern, sir?
Medyo nahirapan po akong humila.
Okay, difficulty of breathing. Now, we'll go to your history of present health concern. Character of symptom or condition, sir?
Madali po akong mapagod.
Chronic tiredness. When did it begin, sir?
Last week lang po.
Last week. Did it get better?
Hindi po.
Worse?
Okay.
Okay. Severity on scale of 1 to 10. 1 is the lowest and 10 is the highest.
7 po.
7. What makes it better, sir?
Wala.
What makes it worse?
Pag gumagalaw po ako masyado.
Now we'll go to your past health history. Do you have problems at birth?
Wala na.
None. Childhood illnesses?
Wala na.
None. Okay. How about acute or chronic adult illnesses? Physical, emotional, mental?
Wala.
None. Do you have surgeries?
Wala.
Accidents and injuries?
Wala rin.
Medications?
Wala.
Allergies?
Allergic rhinitis.
Allergic rhinitis. And then, I will ask about your family health history if you have a hereditary illnesses.
Wala.
None. I will proceed to your lifestyle and health practices profile. What do you usually eat during a typical day?
Fish po.
Fish?
Meat.
Meat? What kind of meat, sir?
Pork po.
Pork
Tsaka soup.
and soups. Okay. Do you eat out at restaurants frequently?
Minsan lang.
Sometimes. Do you eat only when hungry or do you eat when you're bored, when you have anxiety, or when you have depression?
Mahilig po akong kumain pag bored.
Bored only. Who buys and prepares your food, Sir Miguel?
Ako rin.
How much and what type of fluids do you drink?
Tubig lang po, usually. 8 glasses.
Okay, a day.
Opo.
Now we'll proceed to your activity level and exercise. What is your daily pattern of activities?
Sa umaga po, magsasain, tapos maglilinis ng bahay, tapos sa hapon po mag-exercise.
Okay. Do you follow a regular exercise plan?
Wala.
None. What do you do for leisure and recreation?
Nagbabike po.
Biking. Let's proceed to your sleep and rest, sir. Tell me about your sleeping patterns.
Medyo nahirapan po.
Okay. Do Do you have trouble falling asleep?
Opo.
How about staying asleep?
Wala naman.
How much sleep do you get each night?
7 to 8.
7 to 8 hours. Do you feel rested when you awaken?
Sometimes.
Sometimes. Do you nap during the day?
Opo.
How long?
Mga 1 hour po.
1 hour. What do you do to help you fall asleep?
Nakikinig po ako ng music.
Okay, listening to music. In your substance use, how much beer, wine, or other alcohol do you drink on the average?
Occasional lang.
Occasional. Do you drink coffee or other beverages containing caffeine?
Hindi.
No. Do you now or have you ever smoked?
Never.
Never. Have you ever taken any medication not prescribed by your healthcare provider?
Wala pa naman.
Do you take vitamins or herbal supplements?
Opo.
Vitamins?
Vitamin C po.
How about herbal supplements?
Wala.
Okay, vitamins. For your self-concept and self-care responsibilities, how do you feel about yourself?
Okay naman.
About your appearance?
Confident naman.
Okay, you're confident. How often do you have medical checkups or screenings?
Once a year.
Once a year. How often do you see the dentist?
Mga twice a year.
How about for your eyes?
Once every 2 years.
Once every 2 years. For your social activities, with whom do you socialize most frequently?
Mga friends ko po.
Friends. Do you think that you have enough time to socialize?
Meron naman.
In your relationship, who are the most important person in your life?
Yung pamilya.
Okay, your family. What was it like growing up in your family?
Masaya naman po.
Are you close to your extended family, sir?
Close naman po.
Do you have pets?
Meron po dalawa.
In your values and belief system, what is most important to your life?
My family.
Your family. What do you hope to accomplish in your life, sir? Miguel?
Gusto ko po maging chef one day.
Chef. Do you have a religious affiliation?
Wala po.
What gives you hope and strength?
My family.
In your education and work, tell me about your experiences in school or about your education.
Currently po nag-stop ako.
Okay, understood. Do you have future educational plans?
Opo. I'm planning to continue my study this year.
Okay. On what course, sir?
Culinary.
Who is the main provider of financial support in your family?
Yung papa ko.
Let's proceed to your stress levels and coping styles, Sir Miguel. What type of things make you angry?
Yung magugulo pong mga nakapalat na gamit mo. Tsaka may ingay.
Okay, sir. Messy things and noisy people. How would you describe the stress level, sir? On the scale of 1 to 10, 1 is the lowest and 10 is the highest.
7.
7. How do you manage anger or stress?
Nakikinig po ako ng music.
Music. Okay, sir. What do you see as the greatest stressors in your life?
Financially.
Financial. Okay. Where do you usually turn for help in a time of crisis?
Mga close friends.
Okay, close friends. In environment, this is the last question, sir. What type of precautions do you take, if any, when playing contact sports, using harsh chemicals or paint, or operating machinery?
Gumagamit po ng protective gear.
You're wearing a
Protective gear.
okay protective gear. So that's it, sir. That's the health interview, your history health interview. Thank you for your cooperation. Again, I'm your nurse, Louise. Thank you so much.